Hello, Namaste. I welcome you all to the 96th session of GURUBODHA. I welcome you all to this session. And on behalf of us, all of our students, I cordially welcome Dr. Gururaja sir to this session. And I also cordially welcome Dr. Raghuram sir to this session. This session is brought to you by easyayurveda.com. I dedicate this and all of my works at the holy feet of Dr. A. Chandrasekhar Udupa. This class is made live for Easy Ayurveda weekly class subscribers. If you're not subscribed, please go to easyayurveda.com/video-classes. Coming to the topic of the day straight away is regarding oats. There's a YouTube video which explains that artificial chemicals such as glyphosate are used in the production of oats or in the while growing oats, and their levels are oftentimes 5 to times more than many other grains. And glyphosate is related with non-Hodgkin's lymphoma. And even in the organic oats, there is huge chances of cross-contamination threat, which again makes oats not so desirable. So question to Gururaja sir is how to think about oats from Ayurvedic perspective, and also this contamination and other perspective as well.
As my opening remarks, I would like to say that just because some glyphosate or something levels are increased or maybe present in that because they are used while growing it, it may be a contamination, a residue in any oats or anything like that. First of all, we need to understand anything which is done in excess will always be dangerous. Ati sarvatra varjaya. That's the reason why Acharyas have very clearly said. Presently, what has been doing that people have started taking oats in the name of that we need to get reduce the body weight or even something like that, or in diabetes continuously you are using, because this is typically a new type of dravya which you are promoting or taking it as a ahara, not as aushadha, taking in something like a breakfast, a diet. So that definitely it is going to be in a much more quantity if you are consuming it. And from the perspective of Ayurveda, if I consider, oats basically has a dryness which is comparable with all our siridhanyas, what we in India we talk about nowadays, that millets. So oats is also something like that, which definitely has requires a less water to grow, and it fiber, and it is a root in nature. So anyway, it is a root in nature. It requires much more time to digest, and it requires much more water when it is in digestive mode, and definitely it is going to cause a lot of issues for its digestion. And in a long term, if it is habituated, then definitely the oats is going to cause dryness, and it becomes a reason for brittleness in the body. Means brittleness means, how we can compare this brittleness means, tissues may be just like that the person is playing some cricket or some tennis, and then suddenly he develops a muscle tear, a ligament tear, or even the tip of a bone is fractured just by just simply by slipping. So all these things are suddenly not happening. It is happening over a period of time. Your body is becoming more and more dry. Whatever the necessary snehatva is required, that is not being taken in the name of cholesterol and all those things. So this is the thing. We need to have a balanced diet pattern. And until unless if you don't do that, then definitely the oats or anything, it may be definitely going to cause harm. Any siridhanya is also taken in excess, it's going to cause damage. Second thing, cross contamination nowadays. Any drug or any food product, while at the field they're growing, there may be chances of cross contamination, because a farmer may be growing something else in the earlier season, now change it over to this one because there is a market demand, so he may be growing it. The field contains the residues and pesticides, and even the chemical fertilizers what he has used in the earlier crop. Something still it's remaining, and even the water may be sourcing from a channel which may be running through the other areas, or maybe through a city or something like that. Then the contamination of those city drainage is also being tagged. There are multiple issues are there. We need to source out. It is very difficult to source out what exactly from where this contamination is occurring, but contamination is a possibility, but doesn't mean that because the contamination oats is not a thing for everybody, but it should be taken in a requirement as per individual, and dosage should be customized based on the dietitian or the some doctor who is taking care of your health. He needs to give you some ideas how to skip in between, or how much you need to introduce these oats into your diet, all these things. If it is not done, then it is definitely going to cause another issue, that is wear and tear. It's very common.
So it's not like, I mean, we take oats one time and it would cause any sort of side effects immediately. This is akin to the how Ayurveda explains regarding sprouts, regarding the millets, etc. They have their place in therapeutics, they have their place in dietetics, just that it is not suitable for a daily use continuously, replacing our staple ingredients like rice, wheat, etc.
But they need to understand that it should not be consumed on a daily basis. It is not for that purpose. And definitely, votes and all these things needs to be taken care by, taken by those people, those who are markedly obese and those who are suffering from diabetes and such other things. And it's called as Santarpana Janya Vyadhi. In them, in order to reduce that Santarpana or the effect of kapha, we may go for it. But we need to understand that where do we need to stop it or reduce it. When we reach at a balance or the trigger or the threshold or the where we are supposed to reach, if that is achieved, then we need to stop it. That needs to be taken care by the attending doctor or a physician or a dietitian. That needs to be understood.
Thank you there, sir. Raghuram, sir, please.
Obliging with Gururaja sir's opening remarks and also the continuation of explanation. What Gururaja sir said, it's really obvious, and the initial statement, Ati Sarvatra Varjayat, if we understand that everyone, so it's a responsibility for us to understand Ati or Hina are always dangerous. There should be a state of balance. Every decade or every half a decade, once these trendy foods make news, like trendy foods or crazy foods like Siridhanyas. So once the trend started, people started like crazily following that. And what happens in this is, Professor rightly said at the end, the foods which we have been used to take regularly, so we start ignoring them gradually. So because it has become a popular food over a period of time, and people have been following that, and a lot of things have been written in. So nowadays, everybody Google it and see so much of benefits, and there are people preaching that take this only. We'll give example of oats, since we are discussing about oats. Oats taken these different forms, 10 different forms, 10 different or 20 different diseases will go. So what people think is they go to a point of craziness where they start avoiding all other sorts of food, and they make it a Vyadi Pratanika, so like disease specific food. So this is really dangerous, and this is causes an imbalance in the regular food or the food schedule or the practiced or accustomed food what we have been used to. So there, if new food occupies the dining table and it starts dominating our thoughts. Very importantly, these foods are introduced through our thoughts and the thought processes. We think very positively about those things. We start thinking negatively about the foods which we have been traditionally using and cooked in home. And definitely there is a change in pathway of our thinking. We gradually shift towards those foods. There is a trend. I've seen many people strictly go by madness. Like if they're exercising, they exercise madly. If they're taking some Siridhanya or maybe oats or something, they take it madly. If somebody tells take this powder, so it reduces the weight, it reduces diabetes, like go crazy and take those things. So vegetable schedules, all vegetable schedules throughout the weeks, only vegetable soup, or 1 week fruit juices. So this is some sort of crazy schedule where the body is not used to. The body suddenly reacts to such things, and things may be put into balance. So even I oblige what Gururaja sir was telling. Occasionally, yes, because it is a trendy food, let me enjoy this food. Like many things came. So when we were kids, like gobi manchuri was like a fashion food. Like gradually, these pizzas, the burgers, the pani puris all came into the market. So they were fancy food. So we were all attracted. Everybody is eating. Why not me? So let me try. There is no harm in trying once, twice, if it adjusts to our body and also the mind. So occasionally we can take as fun foods, crazy foods, and enjoy with the family occasionally. And so if problem starts when we start making them, when we start seriously including them as family members, so as a member of our regular dietetic regimen, and we start giving importance, and it starts occupying our dining table, refrigerators, and our thought processes, mind, soul, everywhere. So it becomes, we sort of get attached to those foods, and that attachment to a food which might not have a dietetic benefit or a therapeutic benefit on a long term will definitely be harmful. Ati Sarvatra Varjayat. So that's a great statement, sir. So applicable to this and many other new generation foods, so which are still under the hammer of exploration.
Thank you, Raghuram sir. And moving on to the next topic, Ministry of Ayush has published a clarification saying that in the Ayush medicine manufacturing units, which are GMP certified, in those facilities, FSSAI approved food products can be manufactured. So previously, though they are FSSAI means like food supplements. So when they are to be manufactured, or when they are to be, if some facility wants to manufacture that, a food license has to be taken. And many of the Ayurvedic manufacturing units, they follow the rigorous good manufacturing practices protocols as prescribed by the Drug and Cosmetic Act rules and act. So when they are already following all the protocols of medicine manufacturing, probably the idea was that it's a good idea to even allow them to manufacture the FSSAI products in the same facility, because medicine manufacturing takes bigger amount of scrutiny and cleanliness, and so food products can also be manufactured there. So it says Ministry of Ayush has received the request of companies to give approval to manufacturing products under the both Ayush and FSSAI in the same manufacturing premises. In this regard, it is to state that there's no specific prohibition to use combined setup in manufacturing line and equipment for manufacturing products licensed under Ayurveda, Siddha, Unani, and FSSAI in Drugs and Cosmetics Act. Further, there is no direction issued by FSSAI for restricting the manufacturing of food products under FSSAI license in the premises where Ayush products are being manufactured. So, that being said, I think it opens up a lot of new opportunities. One is that it enables Ayurvedic pharmacies to get FSSAI license. Not all Ayurvedic pharmacy owners have FSSAI license, because they were thinking that venturing into food products is again a new battle, and new licenses etc. have to be taken. But they can simply apply with the same facility now that the rules are very clear, and they can start manufacturing Ayurvedic foods and supplements in the same facility. It also empowers Ayurvedic innovation in the food space with more Ayurvedic dietary products like soup mixes, juice powder mixes, and so on and so forth. That is one more advantage, and it also enables non-Ayurvedic consumers to have a taste of Ayurveda and helps them to try more of Ayurvedic products in their daily life. Though not all Ayurvedic ingredients can be used as food, but there are many ingredients like a lot of spices, turmeric, amla, etc., which are used for pickles, etc. So which are used on a daily basis as well. So all in all, a good development, Gururaja sir.
So we need to welcome this. We need to welcome this. The second thing is, we need to understand why this clarification might have been given. Maybe some of the manufacturing units, they might have approached the ministry for clarification. So if you understand the industry of Ayurvedic medicine manufacturing, we can classify these industries into three categories, where a very low profile product manufacturing company, it is manufacturing with less number of people in that, and maybe few products. Maybe they're functioning machineries maybe for a few hours in a day, maybe 6 hours or 5 hours. By the time the requirement or the demand of their products may be ending it. So the industry and that machineries at the space is idle for the next 15 to 20 hours. There are industries where their once session may be like morning's session will be there, but there will be no night production session will be there. But there are companies where 24 hours in a shift model, the people will be, the laborers will be coming in and they will be handling the process, and the process will be continuously going on like this. Industry with such a capacity of where we are 24 hours is producing, so they may not be interested to go for this FSSAI product manufacturing their units. Maybe those which are functioning in the half of the day or only a few hours of the day, then they may go for it. And definitely there is no harm in giving this scope or advantage to the manufacturer, that in house also, when in the same kitchen we produce so many type of products in the same stove, one after the other. Of course, before producing the next one, we will clean it thoroughly, everything, and then we will restart it. So when such type of things can be done at home, why not in a production unit? It also requires the same type of mindset, and as well as the acumen of skillness of the people, that how a cross-contamination, how an neat production of the product may be done. And moreover, FSSAI products nowadays gives wide open or a scope for bringing a new products and a new things in the market. Of course, some of them may become in future become just like how Dr. Raghuram sir has said, the trendy foods. So something may come as a new thing. Ashwagandha biscuit or Chyawanprash chocolate or even something as a bread, Chyawanprash bread, something like that, which can be, all these things are possibilities. So maybe some new granules, Chyawanprash in the form of granules, you can mix it with the hot water and drink it as a drink. So something like that. The new things may come out. Maybe with curcumin and ashwagandha as an immunity modulator, so many things. There are so many scopes. Nowadays, even Shatavari, Estimadu, they're all been gone into FSSAI products as a food supplements. So it gives a wide scope for the manufacturing as well as, of course, the units which is established definitely will run for more hours, and of course it will give more opportunity for production, and it increases the labor hours and production. Definitely it's a good for the market as well as the economy. And of course the people will be given extra scope for having the new type of products. But being a FSSAI product doesn't require much of the experiments and even the studies before they have been marketed. But whereas if it is a Ayurvedic licensed product, then it requires a lot of trials and errors before the things will be put into market. So we can utilize those areas and those laws existing. Accordingly, we can give a new phase of products into the market.
Thank you, there, sir. And but one, Raghuram sir, please. Then I'll make my point.
It's a welcome change. So like the combo working under the single roof, as Gururaja sir said, a lot of scope to do a lot of activities there. Very importantly, we can also plug in the Patya concept explained in each and every chapter of Ayurveda. So that will be the Ayurveda's contribution. So how to inculcate, like we can customize the foods according to the doshas, like a vata specific food, a pitta specific food, a vata specific food in jara, so pitta specific food in amla pitta. So like this, we can customize the foods according to the description of the classics. More research can be brought into that. So this almost Ayush medicines, FSSAI products being manufactured in the same facility, under the both in the same wing. So probably having a common leader or two leaders and a super leader over them, so monitoring a scientific unit also there. So maybe someone of the scientist or who can give a scientific opinion. So this becomes an ideal team for research of, and also to explore the Ayurveda treatises, what Patya have been explained. So bringing them into the practice and also marketing them, as Gururaja sir also has mentioned, Chyawanprash bread and Ashwagandha biscuits. So this no objection over production of these two things under the single roof, as indicated in that particular certification. It clearly indicates that importance. Now people have started accepting that Ayurveda is one of the best in advising, in bringing in the do's and don'ts with respect to the dietary patterns, so in each and every disease, and also in customization of those things. I don't want to name a pharmaceutical company. So I was attending a CME and they were telling that a famous company, they were telling that they have a research under their roof. This was maybe 5-6 years back. There is a research going on in the patient of arthritis, spinal disorders, and other conditions, painful conditions. Along with therapies and medicines, Chyawanprash was being served as a food. Chyawanprash, not in the dose of Rasayana or Avaleha, which has been mentioned, but they were giving 75 grams to 100 grams for the patient to consume Chyawanprash. So Chyawanprash was put on an experimental mode. If that works out, we will bring other. So this almost becomes like a Kuti Praveshaka Rasayana itself, because patient is in the inpatient facility. So like they have an individual cabinet there, so attended by the doctor and also the nursing staff and everybody. So the patient is given a royal treatment there. Apart from the external therapies and also the medicines, Rasayanas at the end of the day are served as food in a bowl. So like in a big quantity rather than we know. So such things. So if medicines can be used in the form of diet, if diet can be used in the form of medicines, we know Patya itself indicates that which is beneficial for the Pata or the Srotas, each and every Srotas. If we can formulate those things, we can avoid so many medicines. So this part of work also can be done. A person who knows Patya, if Patya is followed properly, if Apatyas are kept away, don'ts are kept away, so maybe food or the lifestyle practice. So if these things are brought into practice and strongly, so to advise to a patient, now I have a patient in my OPD, so with whom I'm speaking. So when I suddenly tell diet, now people also have something in their mind. When we go to an Ayurvedic doctor, they will tell some diet. Doctor, what is the diet for me? How can I take? So this is a difficult question for many Ayurveda doctors because on the spot, if it is an OPD, if it is an online consultation, we have already got the patient's history in detail. We can slowly formulate, or we can purchase time from the patient and formulate the diet. So in either case, if we have a ready-made food schedules which are available, we were also speaking about the Madhavbaug very recently when Yogesh sir was there in the last episode. So that preparing a patient customized diet, so like diet packets, and so clearly feeding it into the mind of the people that this day for breakfast and lunch and dinner, you need to take the same things which we have indicated. So then the patient may ask, or the person may ask, how to prepare, where to prepare, we don't have time. Okay, boss, we have it. So FSSI in the Ayush facility, so Ayurveda practitioners, a small clinic, a Panchakarma facility, Ayush medicines manufacturing, FSSI, all things brought under one roof will serve many purposes too. Like we will be attending a patient on the norms of a Charaka chapter or a Vagbata chapter or a Sushruta chapter. So like diagnosis, so a small tool of diagnosis, a laboratory we have, a diagnosis we have a physician, then the medicines are prescribed, the medicines are manufactured there itself, everything not exactly under one roof, Ayush and FSSI, then we have an Ayurvedic hospital, we don't know. These things come into the role in future days also. Everything under one roof. So 1, 2, 3, 4, 5, 6 you visit, you almost have visited a Karaka chapter or a Sushruta chapter of that particular disease, and the patient has been comprehensively attended to. This is a tedious job, but as a part of research and the future of Ayurveda practice, this is going to help in great proportions. So this is what I feel. Over to you.
Thank you there, sir. So while this is welcome, Guru sir, I feel that there should be some restriction on which herbs can be used as part of food, or along with say food ingredients, and which cannot be used. Just to give like a rough example, if someone is using amla, it's fine, turmeric, it's fine. Suddenly comes up with say Vatsanaba or Ballataka biscuit and all. So there should be a white listing of Ayurvedic herbs or ingredients which can be used as food, and there should be a specific guideline of not to use herbs as food. So,
Definitely, there should be some cutoff line for all these ingredients. But right now, I don't think so. There is any such restrictions. But people are using already Shatavari, Estimadu, Ashoka already into FSSI products with mixing with some essential amino acids or something like which is required for the PCOD management, or which is required for arthritic management, something like that, or cardiac management. To that, some in Ayurvedic product in the form of food ingredients, they are taken it, and already in the market there are certain companies have produced it. But of course, there will be certain demarcation between the products which should be used in the FSSAI group and which should be used typically in the Ayurveda drug manufacturing units. But thing is, you observe that these FSSAI products usually those things are taken into consideration for production. Only those which are having some culinary effects or culinary usage, which is used in our kitchens, and all those enlisted in Ayurveda as rasayanas, because these rasayanas many a times have little bit of superiority of rasa over virya of the product. So based on these concepts, where the taste will not be any problematic, such type of drugs are taken into care. It is used, but of course, they may, if you allow them to do it, they may break open every channel and they'll do the nonsense also. There should be some limitation or some breakup, or there some deadline or cutoff line that it should not cross these things, and only they should make a list of those products which can be taken for FSSAI products. If that limitations, some restrictions on the usage, if it is done, then it will be better.
moving on, this has been a repeated theme in this one, but we have to defend Ayurveda wherever possible, so I'm taking this. There's an article in the Times of India, I think it says Times Group, Vitiligo herbal drug caused liver failure Nair Hospital doctors say. Doctors at the BYL Nair Hospital have documented the first instance of a patient with pre-existing liver condition developing liver failure after having Ayurvedic herb Bakuchi for vitiligo treatment. So patient was having liver condition previously. It is not that Bakuchi caused it. This herb is also known as Babchi and widely used for vitiligo. And it is they are reporting it as the first case of it causing acute on chronic liver failure (ACLF), a severe condition associated with organ failure. And our patient was 44-year-old woman, Mumbai Central Hospital in a critical condition, reporting weakness, itching, and jaundice. Dr. Praveen Rathi, head of department, says that his team ruled out other potential causes such as autoimmune hepatitis, viral hepatitis, Wilson disease, zeroing on this culprit, that is Bakuchi. She has been consuming Bakuchi seeds twice a day for 6 months. She was diagnosed with rheumatoid arthritis 5 years ago and found to have vitiligo around the same time. So there was some autoimmunity in terms of, say, rheumatoid arthritis, etc. I don't know how they ruled out autoimmunity as not the cause for liver disorder. Our findings strongly suggest liver failure was induced by the herb, underscoring the need for individuals with liver condition to exercise extreme precaution. So on and so forth. Doctors said the patient has had a close shave. Patient is still alive, but having some liver failure symptoms. Dr. Harsh Gandhi, lead author of the paper, said they sent samples of the Bakuchi medicine and found for a toxicological analysis in Kerala, and it showed lead contamination. Gandhi said the herb's main active ingredient is bakuchiol, but it contains other components like sorolens, which can cause harm to the liver. Kerala-based hepatologist Dr. Syriac Abhi Phillips, he has been quite slanderously blabbering about Ayurvedic medicines, against Ayurvedic medicines for a quite a long time. I led this investigation and the whole procedure of publishing this paper. So, Guru sir, you have successfully treated many liver disorders. We have seen a lot of cases of ascites being treated by you, liver cirrhosis cases, etc., treated by you, and you have also treated, as evident in many of the case studies that we have done, with clear before and after treatment pictures, etc. You have treated many liver diseases also, and also vitiligo also. Have you found any of the liver parameters going up or down during the vitiligo treatment, or is there any connection, or how do you see this?
It is a totally an absurd and a baseless allegation they have made. There are a lot of flaws in their observation. I don't know how they are. And see, look at the way they are making it. When they don't know, they don't find it in any way that this is Bakuchi is responsible for the liver failure. They are producing it as an article or a news bit to the market, and it has been slandering on Ayurveda. And of course, you observe that who is supporting them? It is the none other than Dr. Syriac Abhi Phillips, the one who is day in and day out will be thrashing or trying to debunk or defame the Ayurveda with various inputs. And it is typically from the same group of people these things are done. And if you observe that in that patient, it is having a pre-existing condition, liver condition. So patient is in a pre-cirrhotic condition or a chronic liver disease. Earlier to that stage, patient was there. And if no treatment, proper treatment is given, then automatically patient will move into the cirrhotic area or the domain of cirrhosis, or he may develop or she may develop autoimmune chronic liver disease, which when she enters into chronic liver disease stage, then automatically there will be a lot of itching, abdominal swelling, ascites, lower limbs edema, everything will be there. So it is not a right thing to say that patient was apparently normal before the treatment of vitiligo was started, and there was no change in the liver parameters or LFT, liver function test. After the treatment, then it has happened means, then we would also suspect there may be a cause of Bakuchi may be involved. But this is not so in this case. The condition is having typically a pre-existing liver condition. Point number two, the patient also suffering from rheumatoid arthritis since many years. Simultaneously at the same time she developed vitiligo. And they are ruling out there is no autoimmunity. So definitely, and there is no history of any alcoholism or any drug abuse. So they are trying to put the drug abuse onto the vitiligo, Bakuchi. So it is a very absurd observation from them. We cannot straight away accept it as the truth, because The people associated in this, they got their own agenda to prove, and they'll be day in and day out, they are trying to do these things. Point number, another one important information is Bakuchi is also considered as one of the Rasayana Dravya. So when Bakuchi is of that nature, how can we accept that it is going to cause any problem to the patient? Then point number three, that particularly Bakuchi, the patient is consuming, whether he is consuming under the guidance of Ayurvedic doctor or she is taking by her own way, we don't know. That is not specified in that article. Simply they are telling that this is the thing, it's happened. Just now I have posted one before and after treatment thing in the Easy Ayurveda group. Just look at that. It is in the case of autoimmune hepatitis. Recently, it is the thing. Day before yesterday, she came to me, and that was the condition. You observe, when she came, it was around 30 or 40 serum total bilirubin. But now she is almost 1.5. So it has gone down so neatly, and with pure Ayurvedic treatment, literally she survived. She has been brought to my hospital with support of 3 members. Initial 3 to 4 visits, she used to come like that. Regularly, she used to be carried by the 2-3 people. And today, she happily comes into my OPD without any support. And we have done it through only Ayurveda. That needs to be understood. And I don't accept that Bakuchi can cause any problem to the liver. Of course, anything I already said, Ati Sarvatra Varjayat, something without the guidance of any doctor or anything, simply they are using it without being bringing into the notice of the doctor. If something goes wrong, then definitely you cannot blame the drug or the doctor. It is the ignorance of the patient. And I am using these medications containing Bakuchi in many type of patients, from very young child to elderly person, with lot of precautions. And of course, I never come across not a single case that Bakuchi has resulted into a liver damage. So straight away, I reject these observations, and it has got a lot of flaws in it, and definitely it won't cause any such problem. People are taking it more than a year continuously. I have got patients, that too young patients. So anything happened, they would have definitely happened. So there is nothing like that. So it is very typically understood that this is a bogus observation, or only just to defame the Ayurveda, they have done it.
So probably the concerned doctor in the hospital were not able to treat the condition very well of the previously existing one, and it went to liver failure, and they wanted to blame something, and they caught hold of Bakuchi. Raghuram sir.
Yes, sir. Obliging with this, we have discussed about this also. Gururaja sir has put right remarks on this. I also am of the same opinion. So, Bakuchi, we don't know under what circumstances the patient has been taking that, because even without consultation, without consulting the doctor, and also without knowing the pattern in which Bakuchi or something should be taken, if the patient is consuming, the Sarvatra Varjayat rule, as Gururaja sir said, is applicable again. The patient has taken. Probably it may be an exclusive case where the patient was intolerant to that. Number 2, the patient has taken that without the consent or without consulting an Ayurveda doctor who knows about this, and indiscriminate dosing because they have read somewhere, or they have googled it, or with somebody telling them take this, like again, like mad or like crazy the patient has taken. And we don't know what was the condition of the patient when Bakuchi was started, with what it was started. Many rules are applicable while taking even the herbs, even if it is a amalaki or a haritaki or a bakuchi or a ballataka, every herb needs to be respected and should be taken according to the prescribed norms. Now, I wanted to make a point before that. Gururaja sir already stated that statement, like Bakuchi is a Rasayana. 28th chapter of Sushruta Chikitsasthana is termed as Meda Ayush Kamiya Rasayana. See the beautiful words there, Medayush Kamiya Rasayana, in which Sushruta starts the description of the chapter with the Bakuchi Rasayana. Shweta Bakuchi. See, I want to read some lines. The article is available in Easy Ayurveda as 28th chapter of Sushruta Samhita. So further, those interested can read there, but I like to read in between the lines and see what exactly it tells. Shweta Avalguja Bija. Avalguja is a synonym for Bakuchi given here. And this is administered in the form of Rasayana, in the form of a Kuti Praveshaka Rasayana. So that means methodical administration of Bakuchi has been explained, number 1. And when the preparation is done, only Bakuchi is not given here. It is the seeds are dried in sun and powdered. To this powder of jaggery is added. So this is kept in an earthen vessel whose inner wall is smeared with ghee. There is so much of procedure. The lid is closed, sealed, and it is the whole vessel is kept in a pot and amidst the grains. After 7 days only it is removed. So what is the technology here? See the Sushruta's period. It is sun-dried, powdered, mixed with jaggery, and kept in a pot or a vessel. That vessel is smeared with ghee inside. So we are using everything which so this also indicates that there may be some complications related to Bakuchi if it is indiscriminately consumed. So that is why this preparation of the medicine. So going and taking heaps of Bakuchi might cause problem. We don't know. It may be an exclusive. And Ayurveda also tells according to the dosha, according to dushti, according to satmya, according to one's shakti, Agni Shakti, there are so many factors to be analyzed before giving. And when Bakuchi itself is mentioned as Rasayana by Sushruta, that comes as a Brahmastra, like a last weapon. That means to tell that when some conditions are, when is Rasayana given? When some conditions are not treated by mere medicines, these Rasayanas will come into the play. And then what Sushruta tells, it can be given in a dose of approximately 48 grams. So again, before sunrise, see how specification it is there. Everything is a science. To a person who has been purified, very importantly, Panchakarma is mandatory before giving Rasayanas. So if, see, for Rasayana itself, if I am using Bakuchi, the body needs to be cleansed. It requires an environment inside the system, inside the body for Bakuchi's medicinal properties to be utilized to the maximum extent. So that preparation of the patient is there, physical preparation, mental preparation, everything. Why I am telling these things is, it's not simple, go read Google, take something and gulp. No, this is totally absurd. It is the mistake of the patient. And very important to see here, he should enter a specially built cottage for consuming the rasayana, that is Kuti Praveshaka, as explained in the context of consuming Ballataka. Very important. Ballataka, we know, it is not easy to take Ballataka. Gururaja sir can comment on this. Ballataka Rasayana needs a discipline. Ballataka cannot be just consumed like that. It is a Dravya. Here, what Sushruta is telling is, just like to take Ballataka Rasayana and follow the regulations, all rules and regulations should be followed in taking Avalguja Rasayana or the Bakuchi Rasayana. See, so much of restrictions are there. And come to the follow-up. When the medicine gets digested, the person should take cold water bath towards afternoon. Before sunrise, the medicine should be given. And towards afternoon, the person should take cold water bath. So this is counteracting the effects of, though it is given as a Rasayana, cold water bath. Just observe here. If we go into scientific analysis of these things, it will take ages. What was Sushruta's thought process behind writing this? And then he should eat cooked rice of, that is Shashtika Shali, paddy which has been grown in 60 days. It should be cooked and with milk and sugar at the end of the day. Morning what should be done, afternoon what should be done, evening what should be done. And see the benefits, friends. 2-3 friends, I am reading here. After taking this Rasayana for 6 months, what is important point? It can be taken for 6 months, continuously 6 months it can be taken as a Rasayana. Okay, with following the rules and regulations. The person becomes devoid of all sins, all Papa Karma Nashana. He is bestowed with immense strength and color. Grasping power will increase, memory will increase. The lifespan becomes 100 years. What else do we need? Sushruta clearly writes, the lifespan will increase by 100 years. It may be an exaggeration, but the lifespan will increase by 100 years and the person will live devoid of diseases. Without any diseases, the person can live. So much of, and also Krishna Avalguja, so Shweta, so blue variety and black varieties, its methodologies of consumption is taken. The bottom line is, it is giving a longevity of 100 years lifetime. Disease-free state means liver also is included in our body. It is good for liver. It is good for skin. Skin, it is one of the best rasayanas, the best rasayanas. Then, why are these people trying to defame? As Herbal rightly pointed out, see, when I can't do something, when I don't find anything, I put the blame on somebody else, some other system. That's an easy game to play. So this is all a part of, I don't know, should I tell in this platform or not? It's a part of a lobby. It's a part of something trying to defame our system. Gururaja sir also rightly pointed out. Yes, we had to address this. Hebar sir brought this to the Easy Ayurveda platform. as Ayurveda doctors, we have to. This is not frustration. This is only a thought process favoring. It's not just because I'm an Ayurveda doctor that our Gururaja sir is Ayurveda doctor, Hebba sir is Ayurveda doctor, we are trying to defend Bakuchi. But it is because we have spent so much of time behind these herbs, understanding them and giving to the patients. The main motive of the physician is what? Ayurveda teaches us right in the first year of BMS. Aturasya, see, swastasya swastarakshanam, aturasya vikara prashamanam. So, two types of patients we are handling, which medical science has said. Even you need to handle a healthy person, not only the diseased person. Keeping all these perspectives and basics of Ayurveda, respecting them, we have taken an oath. After that only, after understanding only why experts are giving these medicines, it's not like some Tom, Dick and Harry will come without any knowledge, will put some weird comments and people start obliging that, are also accepting that. I don't know how many Ayurvedic doctors are also seriously accepting this, which is written in the newspaper. So this is totally absurd. A thorough understanding, a person who has thoroughly understood Ayurveda and who has clinically practiced that and has understood the herbs and their mode of action, as Gururaja sir's case presentation clearly indicated. What else do we need? Proof, evidence-based Ayurveda. That is what we are trying to give. So at least on this stage, we could oppose such bad remarks. I am also glad and happy. Bakuchi, yes, again, I also oblige that not only Bakuchi, whatever has been explained in Ayurveda, our gurus used to tell, simply follow the Aptopadesha. Aptopadesha or the Shabda Pramana. We call it as Shabda Pramana. See, such great words have been used. Aptopadesha, Apta. They are like friends. Charaka Shashruta Vagbuta. So they have indicated something. They are not our foes. They are not written wrong. Any yuga, see, the Triphala, one of my guru used to tell, my Triphala at the time of Sushruta, Charaka, and at my time, even my grandson time, his grandson time, the Triphala will be the same. The plants may undergo modification, but the benefits will be nearly the same. It may not be exact as it is in the Samhita, but they are not going to harm. If you understand and give, even a Visha, a poison can cure many diseases. So this is my closing statement. So Bakuchi can be used without any fear in not only skin conditions but many other conditions. It is one of the best medicines. It is one of the best rasayanas.
Thank you, sir. Gururaja sir, please.
We need to understand there is one important issue there. Now, Dr. Raghuram sir has brought about that part of how Rasayana has to be consumed, what are the by the Acharyas. Try to understand here, for purpose of Vitiligo, we take the Bakuchi in the form of a medicine, and our intention here is not to bring the Rasayana effect, just to overcome the Vitiligo. So dose will be much lesser when compared to what we give it for Rasayana effect. Anything, if it is a Kuti Praveshik Rasayana or Vatatik Rasayana, for the purpose of Rasayana effect, intended usage is for Rasayana, then the doses will be much bigger. And Acharya is saying that Bakuchi as a Rasayana in a much bigger dose also, it is not going to cause any harm if these protocols are followed. Then how can with a simple 2 gram churna per day can cause a harm to the patient, that to liver disorder? It is highly unacceptable to me. Very clear. If anything has to be reported, they would have reported in a very sincere and serious manner. But it is their intention are very clear. It is just to defame Ayurveda. They are without any proof. They just put it on a claim that it is going to have a problem because patient was using Bakuchi for one of his health issues. So they kept the blame on that. And another important issue what I observed is the patient is suffering from rheumatoid arthritis since 5 years in this case. Are they not going to give any medicine for that? A patient is not taking any medicine for that. Whether the medicines given by them, it is not going to cause any problem to the liver. Usually they give methotrexate and other things, steroids to control the thing. Whether it is not going to cause a harm, and they are very silent on that part. That's why very clear it is intentionally just slandering. They wanted to just defame Ayurveda, and it is not acceptable, and it is not scientific what their approach of presenting the facts is.
Raghuram sir, please.
Gururaja sir, yes. This is a very important point. Since we are not giving as Rasayana part when it is given in Vitiligo, Gururaja sir made a valid point there. It is given in very small dosage, and if doctor has prescribed, obviously doctor has given a follow-up also. Come next month, we will see the follow-up. Only in such conditions, doctor knows where to give and where to stop. Even a small, it is given in small dosages. Number one, or it is given as a part and parcel of a formulation. It is a part of a yoga. there we need to understand if Bakuchi is a part of a yoga or a combination or a formulation, it is the whole formulation which works. It is not that part of Bakuchi. The combined effect will be always there. The Samyoga effect will be there. And if it is given as a single herb also, as Gururaja sir rightly said, patient coming to us, so we know how much Bakuchi should be given. We are not loading them with absurd doses. This is an exceptional case where the patient has taken in absurd doses without even knowing what is Bakuchi, without consulting, without knowing where to start, where to end. So it is like the story of a golden hen, the hen which gives a golden egg. So a hen was giving a golden egg. The person got greedy, thought, let me cut open the hen and I'll find all the eggs. Ultimately, the hen died and no golden eggs were obtained. This is a similar case. Like somebody said, take Bakuchi. Okay, take Bakuchi. Day in and day out, take large doses of Bakuchi. So if there was a doctor whom the patient was consulting, the doctor would have said, take Bakuchi from this time to this time, come for a follow-up. I will see the improvements and then advise further. That has not been happened here. So this we cannot conclude what has happened to this particular patient, but people are judicious. They judge and jump into conclusions very quickly. When it is blaming the other system, it is very, very easy. As Gururaja sir rightly said, when they are giving steroids and a lot of things, and they mention it as to prevent that damage, this damage. Okay, steroids have been given in rheumatoid arthritis. What steroids would cause in future? What complications it would cause? Will they explain it to the patient? Any doctor? No, because they don't have time. At that time, they have just prescribed the bell on, next patient in, bell on, next patient in. So between bell to bell, they have a time to the patient, not telling. How many doctors have advised their patients to taper the steroids before stopping? They don't even know. For years together, they're taking. Years together, penicillin. Years together, B complex. There are some people crazy, like every weekend they go and take a B complex injection with a doctor. Every now and then they take a penicillin. Steroids, though, they don't even consult a doctor. Doctor said they're finding much relief. They're taking it like indiscriminately. I had a patient where the person had taken steroids for continuously 2 years. This was horrible. All problems the patient had got. Why? Because for so many days. No. Even if the doctor has said, stop it after so many days, the tapering method was not said. Okay, even if that was advised, the patient felt that steroids is giving good results to me, good improvement. Let me take it. Why to go to doctor and waste my consultation fee? Let me indiscriminately take the steroids. Now, how many complications, Vaidya Janna Vikrutis, how many patients we are combating in day-to-day practice, where patients have come with the indisciplinary approach or a bad approach or bad strategic approach by a physician. The physicians themselves have caused complications. Surgeons themselves have caused complications. We have many such cases in our clinical practice where we are combating them. So with due respect to all the medical sciences, so this is what I wanted to tell. Over to you, Hibas.
Thank you, sir. Gururaja sir, please.
Definitely, we need to understand where to draw a line and how to understand this type of bit of information in that. You just observe. This study is supported and planned and guided by that fellow, the same fellow, that liver doc. Their intention is only to defame. If they have any rational approach or a scientific approach, then definitely they would have taken other issues into consideration. They are not taken at all. See, whenever there's, if you find out in a web article relating to paracetamol and liver injury, n number of cases you can get it. People are using paracetamol in a very rampant manner nowadays. And during the COVID period, that is the only drug of choice. Many people, they are consumed like anything. So when such things are being used and this is going to cause damage, they are very silent on that part. And simply in one case, somewhere by accidentally, it is found that then they are trying to put the blame on Bakuchi. This is totally a nonsense way of presentation of the facts.
So there is a huge list of ingredients, allopathic medicines which have been known to cause liver damage, anabolic steroids, birth control pill, erythromycin, isoniazid, methotrexate, statins, one of the most prescribed medicines in the world, making billions of dollars, including, of course, paracetamol and so on and so forth. So there are two things I would like to address is that articles like this should even be not allowed or not encouraged by the allopathic community also. It is not the opinion of entire allopathic community of doctors. There are hundreds and hundreds of Ayurveda allopathic doctors who appreciate Ayurveda and who are trying to incorporate Ayurvedic principles in their practices on a daily basis, and I come across them almost every day. And even for the Ayurvedic doctors also, it is not healthy to have hatred towards one particular medical science, because true nature of any medical science, every medical science is to heal patients. So allopathy does that, Ayurveda does that, so also physiotherapy, yoga, Unani, and so on and so forth. So that is one thing. And Ayurvedic students, the articles like these can damage the mindset of Ayurvedic students also. There's a funny story that was told by a US Ayurveda practitioner itself. He has been practicing many decades, and he told that BMS doctors who migrated to US many years ago, many of them have stopped practicing Ayurveda, and they restarted their career by taking up allopathic, MBBS degree in the US, and they passed and they became like an allopathic doctor, like Ayurveda doctor turning into allopathy in full-fledged form. So once they become allopathic doctor, they start blaming Ayurveda. So our students need to be guided in proper way with. So that was also one of the main intentions of this, not to slander allopathy, because they are slandering us. We will slander. It's not like a tit for tat or anything like that. Ayurveda never grew by suppressing others or blaming others. Ayurveda grew by its natural aroma, natural power of healing the mankind and all. So I just want to end this session with those sentences, and there are a couple of opinion on this in the comment section. I'll just read that. Why not publish an article in the same newspaper asking to prove it was the Bakuchi that caused it, or present an interview with the patient asking who prescribed and why she was taking it? A very valid point there. And there should be some retaliation. Just being quiet makes them stronger. And liver disorders is a concern when it comes to specific treatments. Previously, I've seen cases where Ayurvedic medicines have been blamed by allopathic doctors for issues with liver during their treatment protocol. It is my opinion that more education is needed to correct this issue, and it's good that the topic has been pursued on this platform. It should, however, be extended beyond this also. Thanks. So thank you, all the participants, and on behalf of all of us, my words of gratitude to Dr. Gururaja sir and Dr. Raghuram sir. Thank you so much, sir. Namaste.